Hey dental team, welcome back. Now that we set up our preferences, we'll quickly go over how to actually document within that meaningful use template. I'm going to go ahead and assume that from the EDR you selected your patient and then you made it into the EHR chart of that patient. So now that we're within EHR, we'll go ahead and come up to our template icon in the top toolbar. We'll select the Dental MU template, toggle this down here. And now we'll put in the visit type, select as dental. As far as the reason for visit, once you click in here, you get this blank screen. Just cancel out and go ahead and free text why the patient came. We'll say in this case, dental caries. Next step is to look over medications. Let's just say that you actually prescribe tramadol. So we'll go ahead and do that by coming up to our medications module. Prescribe new. Okay, great. Now, despite doing our medications just now, we still don't see it appear in the dental template. All that means is that you got to exit out of here, click yes to the changes, and then you just need to re-enter it. And now it captures the information. So if you find that you enter in new information under medications or allergies or any of these boxes here, then just make sure you refresh the template in order to see it. Okay, so now we'll go ahead and say medications are reconciled. We'll click transitioning into care stage 1 as well. We'll review the allergies. We'll say there's no changes. Okay. And then under the tobacco status, we notice there it's absent, so we'll go ahead and add in the tobacco status. We'll say that they are a smoker, heavy tobacco smoker, and that they chew or that they smoke cigarettes. Okay, we'll save and close. Now we see that our tobacco information is populated. As far as vitals, you have the option to add in new vitals. So we'll go ahead and do that. And you get to this screen here to actually enter in new vitals. You need to double click this blank slot there. We'll just go ahead and say we measured their blood pressure. Okay, save and close. And now we'll come back to this Dental MU template here. And we see our new vitals have been entered under today's date, which is at the bottom. Just so you know, if you want to arrange it where you see the most recent vitals, click on this date time until you will see the most recent date appear. Okay. Next step is to add in a problem. So we can come to add problem. We'll go to diagnosis code lookup. And this is where we can add in dental caries as the diagnosis, or maybe, it was a different diagnosis. You go ahead and clarify that here. Select it, hit add update to add it under today's assessments. Save and close. And I actually made a mistake, but it's a good learning point. So we'll go back to add problem. We'll notice under today's assessments, we have dental caries, but what I forgot to do, and so I double clicked here to get it back into this middle frame, you need to mark it or add assessment to clinical problems. So I forgot to click clinical problems. Now I'll hit add update and then save and close. And now we see dental caries added into our problems list. Okay, next step is to go over family history. We'll just say that there was no new relevant family history to add, but if there was, you'd come here to this add button, and just to show you the screen, you'd go ahead and click in the family history and then save and close. Okay, and then the last step to do is to hit chart note in order to generate the master IM and then eventually it'll load, and then we can sign off on the master IM. And the way you sign off is by hitting this checkbox or this check mark here. Okay. And we'll see our master IM added into our patient history pane as well. So in quick summary, the main areas to address in the dental MU template are visit type, reason for visit, hitting the checkbox for meds reconciled in the stage 1 box, reviewing allergies, as well as vital signs, tobacco status problems, family history if necessary, and then make sure you hit chart note and sign off on the master IM. We're going to go ahead and avoid these my plan orders just because we're not wanting to chart too heavily within assessment and plan. Okay, so now that we went through all of these different areas, I hope you find it pretty straightforward as far as documenting meaningful use for a dental visit. Thank you for your time.